Hi, I'm Vrinda Mathur, Secretary of NATHEALTH. It's heartening to see the turnout today and the number, especially after the COVID pandemic, the number of people and the turnout from industry stakeholders at the conference today. An absolute pleasure to host all of you here.
So, ma'am, my first question to you is, as we're aware that getting human resource is a huge problem, especially in healthcare. So, how do you feel this problem can be solved?
Sure. I think as Dr. V.K. Paul mentioned in the morning, one of the single most concerns in healthcare across various specialties is the availability of healthcare professionals. Now, healthcare professionals, not just in terms of doctors, but also in terms of clinicians, in terms of technicians and nursing staff, etc. We've discussed at length during the day, but while we cannot address this problem immediately, there is a thought process of thinking of a medium-term solution of short-term training courses, utilizing online technologies as much as possible, and then looking at long-term training as well as increasing the number. The government's already made a lot of efforts in terms of increasing the number of seats for various therapies as well as specialties. We also need to focus on the technician as well as nursing staff, etc. So a lot of great ideas discussed today, but which will be implemented over medium as well as long term.
So, ma'am, I have a question. What benefits would rural India experience by adopting digital health?
So one of the primary reasons why people in rural areas are not able to get healthcare is access, right? Distance is an issue, affordability, etc. is an issue as well. And therefore, if there is a mechanism by which there are facilities that can be made available by using technology, you cannot get specialists down to rural areas. You cannot always have nurses as well as technicians, but we use technologies, use ASHA workers to integrate and bring together people towards patients as well. I think that is the only way a populous country like ours can bring the relevant human capital next to the patient.
Ma'am, my last question. What are the key outputs that you expect out of this event?
I think it's a wonderful culmination of stakeholders who have come to visit. There is a startup pavilion which is also has seen tremendous amount of participation. We're short of space in the startup pavilion as well. But I do see industry, I see government, public as well as private sector and innovation as well as startups coming together. I think it's a lot of learning, and there is a single agenda which is to improve access and affordability of care for people. I think this is a step in that direction. Everything that we do, every discussion that we have is not an end today. It will continue in the form of efforts that we make in the